Hi viewers, welcome to another segment of the Dr. Tebs Health Talks. And today we have Dr. Robin Saggers, who is a pediatrician neonatologist, who will be joining us to talk about a bit about children's health at this time during Corona. Hi Rob, how are you?
Hi Tebs, I'm very good, thanks, and you?
I'm well, thank you. Thank you for joining us this afternoon.
It's my pleasure, thanks for having me.
I wanted to find out. So, you're a pediatrician, you're a neonatologist. Can you explain exactly what those two things are for our viewers?
Okay, sure. So most people will know what a normal doctor is. A pediatrician is a specialized doctor, so it's a doctor who has spent extra time specializing in pediatrics, so just dealing with children. After finishing and becoming a doctor, you specialize for another 4 years, write some exams, and then you are specifically a doctor for children. So you have a bit more knowledge about conditions that affect children and the way that children react to different conditions and the way that children should be treated. So that's a pediatrician. Then a neonatologist is a further specialized pediatrician. So they deal exclusively with newborn babies. So from when a baby gets born to about a month of age, that's the newborn period. Sometimes we deal with things a little bit older than that. And obviously a major thing that we deal with is patients who are born premature. So they are born earlier than they should be, before the baby should be born. And they also have a range of specific conditions that can affect them. And so that's why one needs to specialize even further to study just newborn babies.
That's very interesting, and I'm sure it's a lot of hard work. But I think also the viewers want to actually find out. It's flu season now, and everyone is stressed about children getting flu. And so what advice can you give to parents, guardians, about helping children not to catch a cold, not to catch a flu, especially now as they're going back to school?
Tebs, as you say, that's a very important question. This is the time that people are exposed to lots of different infections, lots of different bugs. As the seasons change and as we head into winter, we normally see some spikes in different types of infections, particularly the flu. So the measures that one can take to limit one's risk of becoming infected is those things that you've been hearing about in the media. So in particular, it's washing hands with soap and water. If one doesn't have access to soap and water, then using a hand sanitizer. It's when we're going outside now in the time of coronavirus, to be wearing a mask, to be keeping physical distance, and to be employing cough etiquette so that we don't cough out into the open air and spread whatever infection we might be having. Aside from that, what we can do to maintain a healthy immune system is just to be wary of normal things that would boost one's immune system, eating a healthy, balanced diet, taking multivitamins, and exercising, getting enough sleep, etc., etc.
Okay. And tell me, how do you tell the difference between a flu and corona? Or do you have anything? Do you have anything? Because I know we have very little information on this, but do you have any information you can give us on?
Well, as you say, there is little information. There is actually lots of it coming out every day. Be careful of information we listen to. The thing is, the good news to parents and guardians is that when kids become infected with coronavirus, they don't have severe disease. So that's a very, very good thing. Not many children are being admitted to hospitals, and those that are admitted to hospitals are not particularly sick. So what that means is it is actually very difficult to be able to determine what type of infection a child has. Children are going to pick up infections over this time, And there's many different bugs that can infect. And there's nothing specific that you can see outwardly between an infection with the flu or coronavirus or any other organism that can affect children at this time. So it's only on testing that we can decide exactly what bug has caused the illness. But the good news is that we don't need to be scared for children in the case of coronavirus, because they are not severely ill if they do become infected.
So having said that and following on that, so if a parent feels, that, I'm not sure, my child was at school, maybe they were exposed to another child who might have had corona, and now they're starting to show symptoms, and I'm not sure now, is this really just a genuine little flu from somewhere else or corona? Do you advise them to rather go to the hospital and to go check it out and get it all tested, or do you think that they should rather wait it out and see? Because I think that's where some people might get a bit confused. So just to clarify.
Yeah, I think that's a very good question. What this has brought to light, this coronavirus pandemic, is that if somebody is unwell, then they shouldn't be mixing with society. Okay. So what I mean by that is, if your child has gone to school, comes back and develops signs of a cold or a cough or a nose or something, it could be coronavirus, it could be any other infection, okay? But to prevent the spread of the infection, that child shouldn't go to school the next day or until at least the symptoms have resolved. As with any infection, if you as the parent feels that your child is very ill or needs to see a doctor, you should still take them to see a doctor or take them to the local clinic. And there, the doctor, the local clinic can decide whether or not one needs to be worried about coronavirus in particular, whether or not one needs to do further testing. So just as if there wasn't coronavirus around, if you are worried about your child and you think your child is sick enough to go to hospital, then still take your child to hospital. If you are comfortable that your child is breathing okay and doesn't have a high temperature, or you don't think is in too much trouble, then keep the child at home. Don't take them back to school until they are better.
You're a health worker, you're a doctor, you're working in an environment where we are so exposed to corona as health workers. How has this affected you personally? And also, how has it affected how you approach your patients now in this time of COVID-19?
It's something that we signed up for, I suppose. When we decided to become doctors, we knew that there were going to be certain risks that we might put ourselves against. And coronavirus is not any different. Previously, if we were dealing with patients who, say, had the flu, there was a chance that we could also pick up the flu. So with the coronavirus, those things are still true. What is important, and I think it's hopefully highlighted everyone, is that we need to be more careful about spreading infections, because what happens is we ourselves, between patients, or even just within ourselves, we might be spreading infections from patient to patient. We might be spreading infections from ourselves to the patient. So we need to be careful with things like hand washing, physical distancing, and being meticulous with thinking about spreading infections and not spreading them.
What would be your parting thoughts? We have this beautiful interview, and you've given us so much food for thought as parents, as guardians, as for our children. But what would be your parting thoughts? It doesn't necessarily have to be in relation to this, but something that you have wanted to get out there to parents and guardians that they should know from a pediatrician's point of view.
Okay, I think the biggest thing is that one shouldn't panic. One should use common sense. Yes, we're heading towards a flu season. Yes, there's a global pandemic with the coronavirus. But if we employ the basic measures of keeping healthy, then your child shouldn't be at increased risk. So it is to be hand washing, to have cough etiquette, but it's also to have the the main underlying things like a good diet, adequate sleep, adequate exercise. And one final thing that I'd like to impress upon everyone is to continue vaccinating their children. Vaccinations have been shown to really improve children's health, and so that's something that mustn't stop in this particular time.
Thank you, Rob. Thank you for coming and being on the interview or the show with us today. And on that note, parents, guardians, do not panic. Take your kids, get them vaccinated, keep them healthy, take care of them. We're looking forward to having another interview with another specialist who will have more to teach us and give us more information on how to take care of ourselves and our families. Thank you.